Hey everyone, and welcome. Today we're going to jump right into the world of laser hair reduction. We'll break down the science behind it, what the process is actually like, and what kind of results you can really expect. All based on some fantastic clinical sources. So let's get into it.
All right, so here's what we've got on tap. We're going to start with the why, the whole quest for smooth skin. Then we'll get into the cool science of how it actually works. After that, we'll figure out who's a good candidate, look at the different lasers out there, walk through the treatment itself, and wrap up with the big one: results, risks, and reality.
So first up, why do people even do this? As you're about to see, for a lot of people, wanting to get rid of unwanted hair goes way, way deeper than just how it looks.
You know, this quote from our source material really just hits the nail on the head. For many, this isn't about vanity. It can be a real psychological burden that just eats up so much time and emotional energy. It's a heavy weight to carry around.
Okay, so how on earth does a simple beam of light stop hair from growing? Let's get into the nitty-gritty of the science, because it's actually pretty fascinating.
Well, it all boils down to this brilliant principle called selective photothermolysis. Now, that sounds complicated, but think of it like this. It's basically a super smart heat-seeking missile. The laser is designed to hunt down one specific thing, the dark pigment in your hair, and zap it with heat, all while leaving the skin around it totally untouched. Pretty smart, right?
And this all happens in 3 quick steps. First, the laser's light gets soaked up by that dark pigment. Second, that light energy instantly flips into heat energy. And third, that heat travels all the way down the hair to damage the little cells in the follicle that are in charge of making new hair. The key thing to remember is this whole process only works when the hair is in its active growth phase, which is called the anagen phase. And this right here might be the single most important thing to get your head around. It's officially called hair reduction, not hair removal. And that's not just semantics. No laser on the market can promise to get rid of 100% of hair forever. That's exactly why you always need multiple sessions to try and catch all those different hairs as they cycle into that active growth phase.
Okay, so knowing all that science, who is this actually for? And maybe more importantly, who should probably steer clear? Let's run through the checklist.
So on one hand, you have the reasons to get it done. Sure, aesthetic reasons are number one, but it's also a treatment for medical issues where hair causes problems like inflammation. But then, on the other hand, you have some pretty clear deal breakers. If you have any kind of active skin infection, a disorder that makes you really sensitive to light, or, and this is a big one, if you're hoping to treat white or gray hair, it's just not going to work because there's no pigment for the laser to target.
And it's not just about the permanent no-goes. There are also times when you just need to hit the pause button. The source material is super clear on this. You need to postpone treatment if you're pregnant, if you've been out in the sun recently, or even if you've waxed, which makes sense, right? The laser needs the hair in the follicle to act as a pathway for the heat.
Okay, let's talk tech. This is where things get really interesting, because not all lasers are the same. Not by a long shot. Picking the right tool for the job is absolutely essential for getting good results and, most importantly, for being safe.
What's so great about this table is how it lays out the main options. The key difference here is the wavelength of the light. Shorter wavelengths, like the alexandrite, are fantastic for people with lighter skin. But for darker skin, you have to use a longer wavelength, like the Nd:YAG. And the reason is so important, it bypasses the pigment in the skin itself and goes straight for the hair follicle. That makes it so much safer. And by the way, you'll see IPL on there. It's not actually a laser, and most experts agree it's just not as effective.
And boom, here's a perfect real-world example of that. This quote comes directly from the clinical practice in our source material. They're saying that for their patients with darker skin tones, the NyAG laser is their #1 choice, hands down, because it's both safe and effective for that specific skin type.
All right, so you've passed the test, you're a great candidate, and the right laser has been picked out for you. So what's it actually like in the treatment room? Let's walk through it.
Well, it's a very structured process. First, they prep your skin. It gets cleaned, any long hairs are shaved down, and then they'll usually put on a numbing cream. During the actual treatment, a cooling device is constantly running to keep your skin comfortable and protected while the laser does its thing. And afterward, it's all about soothing the area with ice packs and then being super strict about sun protection.
Okay, this part is really cool. How does the clinician even know it's working in real time? Well, they're looking for something very specific, called the clinical endpoint. They want to see the hair kind of singe up a little bit, and then see some slight redness and swelling right around each follicle. That's the visual proof they need that the follicle got a direct hit of energy. All right, let's bring it all home. We need to talk about the bottom line. What results can you actually expect? What are the real risks involved? And what's the long-term reality of all this?
You know, even though this is a very safe procedure overall, side effects can happen. This chart gives us a really good sense of the landscape. See that huge chunk, 70%? That's the common, temporary stuff we just talked about, redness, a little swelling. Then about a quarter of potential effects are less common, and that tiny sliver, just 5%, represents the really rare stuff.
So let's break that down a bit more. Of course, you're going to have some pain, redness, and swelling. That's totally expected. But then you get into things that are less common but more serious, like changes in your skin's pigment, which is a higher risk for darker skin tones. And then there are the very rare but very serious issues like getting more hair growth, burns, or even scarring. And that really drives home why it's so important to go to a qualified, experienced professional.
And look, we're ending this section right back where we were before, with the single most important message of all. This is a direct quote from the source's conclusion. The realistic goal, the thing you should expect, is hair reduction, not total hair removal. Getting that expectation right from day one is everything.
So there you have it. Laser hair reduction isn't magic. It's just pure, targeted science. It's a powerful medical procedure where everything depends on matching the right person with the right technology. Hopefully, now that you understand the science and the process, you're in a much better position to have that conversation with a professional and decide if it's right for you. Thanks for watching.